Hello everyone, welcome to Lecture 5 of Ocular Allergies. In this lecture we're going to be looking at year-round or perennial ocular allergies. Now year-round allergies occurs when you're exposed to an allergen that you're in contact with all year round. 90 to 95% of patients will have a combination of year-round or seasonal allergies. The other 5 to 10% have more severe ocular allergy conditions, and these will be discussed by my colleague Dr. Jason Noble. When we look at allergens that exist throughout the year, one of the common allergies that comes up is dust mite. Now, if we plot this on a graph, if you look closely, dust mite levels do fluctuate throughout the year. In the winter months or late fall, when you turn on your furnace, this often creates more dust mites. The conditions become more favorable, and we do things such as keeping our windows closed, which also increases the dust mite levels. As such, in the winter, ocular allergy sufferers who have dust mite allergies will have worse symptoms. In addition to this, patients are typically worse in the morning. This is because at nighttime you are in much closer proximity to the dust mites and you happen to be inhaling them more. Now you'll remember the nose is actually connected to the eye through what is known as the nasolacrimal duct. This results in more severe ocular allergy symptoms in the morning. So year-round allergies, perennial allergies, typically result in more association with allergic shiners. Allergic shiners, if you remember, is due to venous congestion that results in capillary leak around the eyes. This literally is a bruise from an allergy. Other perennial allergens other than dust mite include pets and indoor molds. Indoor molds are at higher concentration and more likely to cause allergies if you have a lot of potted plants or water damage in your walls. Let's look at how to deal with each of these in non-drug ways of management. When we look at a bedroom, we see that there are pillows, blankets, mattresses, and sometimes carpets. All of these are a potential source of dust mite. Fortunately, dust mites can be killed if you wash things in hot water. As such, frequent laundering of your bed sheets, pillowcases in hot water will decrease dust mite concentrations and thereby minimize your allergen burden. This will make a small difference in how many symptoms you have. Now, when we look at pillows and bed sheets, some people prefer to encase them in dust mite proof covers. Again, this has a small improvement in symptoms by reducing the allergen burden. Some people will also remove carpeting, which will also eliminate some dust mites. Other people will install HEPA filters or other air filtration devices, again making a small improvement in allergen burden. Many of these strategies can coexist, and if you can, you try to do all of them. However, I will state for the record that you should not expect a huge difference in your symptoms from doing all of the above. Now let's move on to mold. Oftentimes, companies will come in and measure the mold spores in your home and simultaneously measure them outside your home. They compare the two values, and if your mold spore levels are higher in the home, that is when most patients agree that there's too much mold. If there's mold that you can see on your wall, you should probably get rid of them. If you have mold allergies and you're getting significant symptoms, it may be worthwhile to remove the potted plants. Generally, as a rule of thumb, if you can see it, there's too much. Now let's move on to pets. If you have an allergy to any pet, this could potentially cause year-round allergies. Now, most people are quite attached to their pets. They become like family members. So I hate giving the advice of trying to get rid of the pet, and will only do so when absolutely necessary. Other practical tips that one could employ is having the pet stay in their own dwelling or having them outside of the bedroom. Make sure your pet is well taken care of, though, if you are having them live somewhere separately from you. Now, some people will have a hard time keeping their pet outside of their bedroom, as the pets often get very attached. But remember, pets can be trained, and it's important to keep your door shut so that they do not come into your bedroom. This applies for other pets as well, including hamsters, gerbils, rats, and birds. Keep them out of the bedroom if at all possible. If you have a multi-story dwelling, it may be actually worthwhile to keep your pet on a separate level from your living quarters. Pet shampoos and allergen shampoos do work to some degree. However, you have to wash them very frequently, and patients often get frustrated that this is often impractical to do. Now, there is this myth out there that even President Obama himself fell for. There is no such thing as a hypoallergenic dog. Dog allergens are many, but the most common is dog epithelium, which is essentially a dog's skin. Now, there is no dog that doesn't have skin, and as such, there's no dog that you can't be allergic to. Often the size of the dog is what determines how much symptoms you experience with a pet. If we look at cats, it's also a similar story. Cat epithelium is a common allergen. However, interestingly for cats, male cats tend to be more allergic than female cats. No one knows exactly why, but male cats produce more epithelium. It's thought that they're perhaps trying to mark their territory. Color of the cats also makes a difference too. Black colored cats actually produce more allergen than tabby colored cats. No one knows why this is the case, but seems to be one of those little quirks of life. In the next chapter, we'll be discussing the various treatment options.